shows that it takes about 7 therapists for somebody to find a good fit.
Really?
Historically, we know that psychology was an art that was systematically used to further oppress Black communities and communities of color by extension.
Say I'm a client and I'm coming to see you. How might my experience with you be different than if I were to go to a traditional therapist?
So in a way, like, systemic thinking is like built-in social justice oriented.
How might that approach be different than like Islamic psychology?
So it has to be a both and approach. It can't just be one or the other.
I guess with that, any final thoughts?
Therapy may not be your end-all be-all for all of your problems.
I get asked a lot for therapist recommendations. And a lot of times, this is from friends and family who maybe have tried a few different therapists and have really found it not helpful. Sometimes it's from people who have actually found it really hurtful. And over time, I realized that there is actually a pattern. And so I wanted to do something about it, to start a conversation about how there is a different way and that healing is possible, and maybe begin a shift in our communities that is long overdue. And I couldn't find a better person to do it with than with Zam. Dr. Zamzam Dini is a phenomenal clinician who I've had the pleasure of working with. She is a clinician, scholar, and educator, and with a doctorate in couples and family therapy. Dr. Zamzam Dini brings a deep commitment to trauma-informed care. In the past, she's taught at the University of Minnesota, and she is currently core faculty and assistant professor at Alliance International University. I really enjoyed our conversation, and I think that you will too. If you find any of it beneficial, then I hope that you will find someone else that you will pass it along to. And without further ado, let's jump into the conversation. Zam, welcome, and thank you for doing this with me.
Thank you for having me. I appreciate the opportunity.
Well, to start off, Zam, you are a systemic therapist. Tell us a little bit about what that is and how that might be different from most other therapists out there.
Yeah, and so I think, when people think about like therapy, right, the first kind of field that comes to mind is psychology, right? And psychology is a very old institution, right? It's been around for a very long time. And when psychology was becoming a little bit more mainstream, and kind of competing with like the medical model, just wanting to be more objective in nature, wanting to have more credibility, right? It really did, follow the medical model in a lot of different aspects. And one part of that being kind of the focus on the individual. What is happening with this person internally? Like, how can we change how they're thinking, right? Kind of a prescription-based approach of like, tell me your symptoms and I'm going to prescribe you something that is going to change kind of your fundamental nature about like how you're thinking about things, your conceptualization of your lived experience. And as that kind of progressed, a lot of people have realized that doesn't really work. Like, it's not really helpful, right? And so people kind of started thinking about, well, how do we think beyond the individual, the one person that's in this room with you? And so in the early kind of 1950s and 1960s, a lot of scholars, including Dr. Gregory Bateson, John Haley, Virginia Satir, all of these kind of founders of MFT, wanted to understand people and mental health from a systemic lens. And so how are other systems at play influencing this person? And that was a huge shift in psychology. But when we kind of take a step back, we understand that the global majority, a lot of people in the world, really have shared understanding of interdependentness. Like, a lot of cultures, majority of the cultures of the world, have a collectivist viewpoint, right? They understand that my interactions or my actions impact my family, my own individual needs may sometimes not be a priority, and that's okay. And so when you have systemic thinking, it really aligns with the majority of the world's cultures, which I think is a unique position that MFT has versus social work, versus psychology, right? All these other fields that really focus on let's talk about the individual, but let's also just build insight. Let's like understand what's happening for you, and then try to have you be the agent of change. Versus MFT, understanding the influences of change around you, and then putting that into context and then moving forward with treatment, right? That's kind of different.
Yeah, and I think that's probably one of my favorite things about, or what drew me to the field.
I had that same aha moment because I was a psychology undergrad.
You were?
Yeah.
Oh, I didn't know that.
So like, I mean, we were learning about Freud, right? All of these folks, and all I see is like white, male, like atheists, right? Like all of these things that I'm not.
Yeah. Yep.
Right? And the people that I want to work with are not.
Yep.
And so for me, sitting in a classroom full of like 200 students, and I'm sometimes the only person of color,
Yep.
Realizing, hey, psychology is not really compatible with my lived experience, how I understand the world. And the only thing that kept me going was when I become a clinician, when I become licensed, I can operate however I want to.
Yep.
So that was like the caveat that kind of kept me in the field.
Yeah.
And then I come to find, MFT, and I was like, people think like this? Like, it really was like, wow, like, I'm really glad I don't have to, like, keep putting caveats on everything. Like, there are people that share this same understanding.
Yep.
And it worked.
So then I guess if we were to break that down into a practical level, say I'm a client and I'm coming to see you, how might you treat me or my experience with you be different than if I were to go to a traditional therapist who's trained in the psychological worldview?
Absolutely. I think there is a misconception that like MFTs only work with couples and families.
Yes.
And that's, I can work with individuals. Right?
Yes.
I know some colleagues that only see individuals.
I'm glad we cleared that because I get that a lot.
and so you can still work with somebody from a systemic lens with only working with the individual. And so that can look different. So it really depends on your theoretical approach. And so if I'm working from a systemic lens, we're talking about your family system. We're talking about relationships that you have. We're going to talk about friendships, how you think about yourself, kind of what is your story, what is your narrative about yourself, and how is that impacting the needs that you have that brought you to therapy. And this is really especially important for minoritized clients. How has like historically oppressive systems impacted your lived experience that you are having right now? And how are we addressing that, making space for it, and maybe externalizing a lot of the issues that you're coming with. Sometimes, when we've been experiencing racism for a very long time, we tend to internalize a lot of those things. And so therapy really helps you kind of take the blame off of yourself and place it on the system.
Nice.
And that itself, because we can't, racism is not going to be gone, right?
Yeah.
We can't
Yeah.
be like, poof, no racism.
Yeah.
But we can change how we kind of process it, how we think about it,
Yep.
and how we deal with it.
Yeah. To me, that almost sounds a little bit more human.
Yeah.
A little bit more like, wow, someone actually understands this,
Yeah.
not just me.
Mm-hmm.
That maybe it's other factors that are contributing to this too.
It's non-pathologizing.
Exactly.
I think because psychology really wants to be a hard science, respectfully, they tend to label people, right? Like a doctor gives you a diagnosis, and so they operate based on that diagnosis. And psychology operates the same way. So for them, it's more about like, this is a person with X diagnosis, and I'm treating the diagnosis.
Yep.
I'm not looking at the person, their context, their lived experience, how they got diagnosed,
Yeah.
who diagnosed them.
Uh-huh.
Right? Research shows that, there was a study that was done where, patients came in and they had the same exact symptoms.
Yeah.
And one patient was white, one patient was black. And the only difference between the diagnoses outside of symptoms was race.
Uh-huh.
And so the white patients got the lesser diagnoses.
Wow.
And the black patients got schizophrenia.
Wow.
And the only difference between their symptoms, between the two people, was their race.
That makes me so mad. And that is probably because I can't tell you how many people that I've met in the community, like these are people that I know personally, that walk around carrying diagnoses like bipolar, like schizophrenia,
borderline
personality, and And to me, I'm like, I mean, yes, we have a personal relationship. I don't have my therapist on, but the therapist in me can't help but want to say, like, I don't see that in you.
Schizophrenia.
And I wonder, like, how much of that is like the bias from therapists
and it stems from that individualization, right? Like, you are paranoid because you think people are out to get you. Every time you see a police car, right, you're overreacting. When we're not taking into context, this is a black man. And police have historically brutalized black men. And his response is expected and a normal response to fear. And so when we Dr. Resma Menakem, I always quote him. Right. He talks about like trauma. He talks about the importance of context when talking about racialized trauma. And his quote that I use everywhere is like, trauma decontextualized, right, over time, in a person can look like personality. And then trauma decontextualized over time in a people can look like culture. And so if we take away the context, all you're left is what? Symptoms. And now I can kind of label you with these symptoms and write you off. And not really take into consideration your entire lived experience. We can't really put the human experience into one diagnosis.
I'm glad you brought that up because one might hear this and might think that we don't diagnose or like we underdiagnose, but what you're saying is slightly different. It's not that we underdiagnosed compared to our psychologist colleagues, but it's more so that we take into account the human that we're seeing in the context and the culture. Am I hearing that correctly?
Absolutely.
Okay.
Because any of us can really open up the DSM-5 and align with all of these symptoms.
Oh, wow.
Right?
Oh, that's so real.
It's designed to be general enough where people can fit in these boxes. But it's too general that we forget about context and relationships and systems. And so it's like, this isn't sustainable in a way, right? Because clinical judgment, right, is human. Right? We don't have AI yet. I don't know. We'll have it soon. But the person reading these symptoms is a person. And if we don't take into context their lived experience and what lens they're looking through, they'll see symptoms and automatically, because of personal biases, right, label someone schizophrenia versus PTSD. When really it's not the diagnosis that is different, it's the person's worldview. And that's like, there's a lack of training in that too around, people will fall back on, this is my clinical judgment, but really it could be subjective biases.
100%. I attended a training with Dr. Steve Harris this past summer, the discernment counseling one. Somebody had asked him about when they're seeing a couple, like how would they diagnose or something like that. And he said, I like to lean less on the axes and more just on the human in front of me or something like that. And to me that was so like this is what systemic theory and systemically trained therapists are rooted in, this humanistic view, this humanistic lens. What do you see as some of the potential dangers of that, of someone being given a diagnosis that culturally, that context was not taken into account?
I think we, as systemic therapists, we understand that we're only getting one part of this person's story. Right, and a diagnosis is one part of their experience. And let's say it's 1/6 of their experience. What about the rest of their entire life and how they show up, right? And so it's just like an assessment. An assessment gives you this person's understanding in that given moment. Give them an assessment tomorrow and they could have different answers. And so a diagnosis is just like that. The diagnosis is this is what's happening for this person right now. This is how they're showing up. And it shouldn't be a permanent label that defines who they are, their character, and the kind of narrative around that. There shouldn't be any baggage behind a diagnosis. Some diagnoses are more taboo than others, right? A lot of therapists have their personal biases around that too. And so when we think about the relational and contextual meaning of symptoms too, yes, this person is showing up with depressive symptoms, but what is happening in their family system that is maybe feeding into these thoughts? or kind of showing them an opposite experience of what a healthy relationship looks like. How is the family context, the environment, the school context, society as a whole feeding into or adding to the depressive symptoms of a normal teenager?
Makes sense. So if you have a teenager that's brought to you by the parents, and the parents are like,
Fix them.
They're crazy, they are
drive-by therapy, right?
Drive-by
Drop them off. I'm like, you can come in this room with me. I do not work with adolescents by themselves. Because they're adolescents, right?
Yeah.
Who are they getting their model of a human behavior from? And so when we're doing family therapy, I mean, when we see a teenager, this teenager is not old enough to kind of have their own formulation of who they are. So they take that from the family system. And so I need to see the family system that has helped create some of these issues.
Makes sense.
Because I can work with this teen and then put them back in the same environment, and now all of the work we've done is kind of unraveled.
Yeah.
Because the parent-child interaction is still the same.
That's fair. That makes sense. So it's almost like you're pushing back against the narrative of maybe there isn't much that's wrong with the teen or the child or the client, and maybe let's fix the system at large so that this person can thrive and no longer has these symptoms that people can point at and say there is something wrong with them.
I like to think about children, adolescents as thermometers, right? They sponges. They kind of soak up what's happening in the family system.
Yeah.
Especially with younger children who can't kind of verbalize or they can't understand the family dynamics. They tend to quote unquote be the sacrifice. So they'll show more externalizing behaviors that'll force the family to seek therapy, to seek help.
Makes sense.
And they're doing it at a subconscious level. But if and families tend to have what we call a scapegoat.
Yeah.
Right? And when you focus on the scapegoat and everything they're doing, the family system doesn't have to worry about their own problems.
Right.
They are better than this person.
Yeah.
And so all of the problems we have is because of this one person.
Right.
And so we come as relational therapists and we're like, you literally cannot exist in a vacuum. Something's going on here.
Yeah.
And everybody is playing a role in it.
Right.
And we have to understand what's happening for everybody if we want to change the kind of mechanisms in the machine that is allowing it to function in a way that is unhealthy.
Yeah. To me, that sounds like it's really empowering to the client. That because I've seen so many people who walk around with something's wrong with me, baggage. You can almost see it in the way they sit, in the way they walk around the world. And I'm imagining if I was a teen or whatever, and it doesn't have to be a teen. We've seen so many people who the aunt, the sister, the mother is this person's crazy. Fix them. There's one person. Right. I imagine that for me, that would be really empowering for me to realize maybe there isn't something wrong with me, and to kind of externalize some of that blame or baggage that gets put on top of these people that are wrong or messed up somehow.
Yeah. So in a way, systemic thinking is built-in social justice oriented.
Yeah.
Right? Because we get to unbalance the relationship.
Yeah.
Right? Or kind of shift the dynamics in a way that this one person can't go against the entire system.
Yeah.
But we get to interrupt that pattern, that cycle, and be actually, I'm noticing this interaction. What is that about? And kind of giving them voice and giving them space to kind of see themselves in a different light.
How might that be more of an empowering approach to our community and to communities of color at large, to be treated or to be looked at with that lens, as opposed to the standard psychological one?
I think you said it before, we get to humanize them.
We get to humanize them. Yeah. I'm kind of imagining this on a larger scale. If we were to take a given community, say, I don't know, the people of Minneapolis or something like that. And I'm imagining if in that given population, everyone's treated or seen by a psychologist who's using the dominant psychological lens, imagine what it would do to that specific population if every individual in that population is walking around with here's now something wrong with me, and here's now something wrong with me, a group of people walking around, so many of them with this thing that's wrong with them, versus maybe a different subset of the population who is seen by a systemic therapist or what have you, and it's all like more humanized. Like there's something wrong with you, but there's something happening to you, and there's something happening to you, and how empowering that would be for that entire community to kind of walk around with like things are happening to us, and we could do something about it. We could fix it. We could change it.
A lot more people would be accepting of therapy. They would reach out and go to therapy just like they go to the dentist for a toothache. Yeah. Right? Like it would be so normal because it is.
On the note of mistrust, there tends to be a lot of mistrust in our community, the Muslim community, but even the other minority communities as well. Mistrust in the whole therapy and mental health world. Rightfully so. How do you think the like psychological worldview or like the foundations of psychology. How do you think that may have contributed to some of the mistrust, say, like for the Muslim community?
Historically, right, if we think about psychology and its role, I don't know if you saw, but the APA, the American Psychological Association, issued like an apology for their role in like racism a couple years back.
Interesting.
Like hashtag our bad.
I didn't see that actually.
They issued a statement apologizing for the APA's role in perpetuating and creating systemic racism. Okay. And using data and science to back up the understanding that individuals had different psychological ability based on race. They like proved and provided evidence for the fact that white people had a higher genetic and psychological hierarchy, and how psychology has historically pathologized Black communities, minoritized communities, right, and just labeling people with mental illnesses, right? Even if you think about like enslaved Africans, right, like the desire to run away from the slave master was a psychological disorder that they were diagnosed with. Really? Right, I remember the name for it. Wow. But it was a legit thing that people were diagnosed with. Wow. Right, and so historically we know that psychology was an arm that was systemically used and systematically used to further oppress Black communities and communities of color by extension. And so when people are hesitant about going to a psychologist, I don't want to be labeled crazy. That's a very real fear, right? Like people would lose their autonomy in their decision making based on one person's clinical judgment. That was not contextualized, that was based on bias, and that was based on science that was only used to test like white upper class families. Right? If you think about how are these diagnoses developed, how are these theories created, but by definition they weren't created considering contemporary families. Right? So if I take this family and I study their behavior, and I say this is the standard for how families should operate. And I take this new family that is different in culture, in race, in history, in understanding, and I use that measurement to assess this family. Fundamentally, they're going to be different. And that difference was then pathologized. Oh, you're not operating correctly. Right? Like, and so for an example is like this understanding of like codependency or interdependence. And so now there's an issue with this family system in how they operate because they don't operate the way I think a family should. And where is this should coming from? Right? Like, and it's so implicit, it's so automatic that we don't really realize. And so when we as marriage and family therapists work with couples and families, we have to always consider it's not my family, right? It doesn't matter how I operate and how I would operate. That doesn't give me a right to pathologize this family and what's going on with them. And when we only focus on the individual and we're looking at like how are they thinking, and I just throw coping skills at you, and I don't consider the entire family, then we really are doing an injustice to this individual because we're not really understanding their entire human experience. We're just saying deep breathing exercises will help you with your relationship with your mother. It doesn't make any sense.
That makes sense.
But we're blaming this child for, maybe not passing their classes and not being able to concentrate. And so we're like, you have ADHD.
Makes
right?
sense.
It's not the fact that maybe they were up all night last night because their parents were arguing and they can't stay awake for class. Right? When we don't contextualize the experience, we just throw symptoms at this person.
Yeah.
And we really just focus on that.
Yeah.
And we blame the person.
Yeah.
For a natural response to the
Yeah.
environment.
Makes sense. So you feel like it's a lot of it is that traditional psychology was normalized and developed on a specific group of people, and that tends to be white middle class folks. And so the difference is that then psychologists see and other people sometimes get pathologized
because that's the standard.
Because that's the standard.
That's the default setting.
Makes sense. And anything that deviates from that
is wrong.
And of course that would contribute to a whole population mistrusting the system, because the system thinks something's wrong with me, as opposed to maybe asking what may have happened to me or trying to help me.
It's really sad when you think
Yeah. And what about on a more religious or like spiritual level? I sense that there's a lot of mistrust in faith communities. I can speak for the Muslim community because I see that a lot. People are always afraid that the therapist will alter my child's faith or religion. How might like the history of psychology or the foundations of it be a reason or contribute to why people have that mistrust?
in the beginning I said psychology is very white, male, and atheist. Right?
That's right.
There's no space for spirituality in
There is
psychology.
no space.
Right? It's all about your cognition,
Right.
what you're thinking, impacts how you feel, impacts how you behave.
Yeah.
That's it.
Yeah.
Right?
Yeah.
ABC.
That's
What about
right.
the rest? What about relationships? What about spirituality?
Right.
Right? What about physical health?
Right.
None of that is taken into consideration.
That makes
Whereas
sense.
as systemic therapists, we have a biopsychosocial approach.
Gotcha.
Where we leave room for everybody and their lived experience. Right? You want to talk about God in therapy? We can talk about God in therapy. But from your own perspective.
Right.
And so I'm not the one initiating the conversations.
Right.
But I'm leaving space for that.
Makes sense.
And when we think about the pathologizing, right? A lot of communities have different cultural idioms for trauma. And so they may not say depression or anxiety, right? But they have the same, similar experiences. And if that community wants to make a meaning of this symptom through a spiritual lens, let them.
Yeah.
Why is that so bad, right?
Yeah.
Why do we have to push them into a box that says, no, you have depression?
Yeah.
When it's maybe I have low spirituality right now.
Right.
Maybe I need to incorporate more prayer and more kind of conversations with God alongside something else.
Yeah.
Right? If somebody brings up God, and mental health, it feels like the assumption is that it's incompatible.
Yeah.
When the spirituality is just as important in the human experience. Right? You don't have to be religious.
Right.
People can be spiritual, and if we kind of leave pieces of the lived experience out, how are we being systemic?
Makes sense. So the systemic lens is more holistic in that way, and that it takes that into account and it takes that into perspective. And this might be slightly off topic, and this might be just the inner nerd in me that wants to ask honestly, how might that approach be different than Islamic psychology, who also is let's take all these into account. How might the systemic approach be taking that into account, but in a, I guess, different flavor or different way?
Yeah. Because again, right, it's this limited one slice of the human experience
Sure.
that we're kind of focusing on.
Sure.
When we have an Islamic only approach, right, we're forgetting about the relationships.
Right.
What about the people? What about the culture? It's really easy to kind of overshadow the role that each person has to play in the system when we kind of take a hierarchy approach, where it's let's not look at the individual dynamics or the context. Let's just focus on spirituality and religion. We lose people.
Yeah.
We lose a lot of that lived experience that really does make an impact.
Yeah.
And so it has to be a both and approach. It can't just be one or the other.
Makes sense.
Right? An example, there's this couple that I'm working with now who they're struggling with, addiction. And first they went to a therapist that was white. And so that therapist was like, well, smoking isn't that bad. Right? And they were like, no. And so they went to an Islamic counselor and was like, when we went and worked through this, and then the Islamic counselor was only kind of focusing on, well, you need to be patient with each other and kind of like, this is a test from Allah and that, you should just be passive. And so that's not what they were looking for either. Right? And so like, it's they could tell like, well, there isn't that kind of, relational counseling training that's there.
Right.
And so, like, working with me, it's like you get to bring in as much Islamic values as you want,
right?
And we're still using a systemic approach. Like, we're not leaving anything out the door. And our therapy can be kind of, based on like your value system and what you want to talk about. So if you want to operate from this understanding that I want, my goal is abstinence, then we're gonna do that. I'm not gonna say you'd be like, well, it's not that bad.
So if I'm hearing you correctly, the psychological lens is cognitive behavioral and like that ABC that you were talking about. Math equation. The Islamic psychology lens might have adapted that in a way, but put an Islamic filter to it. Don't think about
something else.
Gotcha. And then the systemic lens might be more of a holistic one where it's like, let's take this into account and this into account and all these aspects that will lead to ultimate and true healing for the individual.
Yep. Because one presenting problem or one issue can be spiritual in nature, and another issue can be relational in nature.
Right.
And I get to address both at the same time.
Yeah. And
without one like kind of falling off on the edge.
Yeah, that makes sense. This is like mind blowing in a way because I'm thinking about like younger version me, like undergrad me, and like how much I wish I would have had someone say this to me because it was like there is this and then there is this and it's like, but what about in between? On a unrelated note, something else that I wanted to ask you about. So it's a common experience for me that my clients are clients who have gone through 1, 2, 3, 4 different therapists before landing in my office.
Yes.
And I wonder if that's something that you experienced as well. You talked about this couple. Is that something that you see?
Research shows that it takes about 7 therapists for somebody to find a good fit.
Wow. Okay.
Yeah. Because, if you think about it, like therapy, we're not using a tool, we're not using a software.
Yeah.
Like, we are the tool.
Yep.
And so that human connection has to be there in order for it to be effective.
Makes sense.
And you're not going to find like a good fit with everybody right off the bat.
Right.
There's a lot of like lived experiences, maybe personal biases. Some people just trigger each other, right? So there's a lot of different reasons why people may not find a good fit right away. And so that shouldn't kind of push people away from therapy.
Yeah.
It should just kind of motivate them to seek somebody that's a little bit more aligned with their lived experience. And that's okay. I kind of try to normalize that for people.
That makes sense. And outside of the lived experience part or the fact that it does take some time to find a good fit therapist, which I do believe is super duper important. Do you think there might be something about a client not having experienced a therapist with a systemic lens that may be a contributing factor to this phenomenon?
I do believe that, when folks encounter clinicians that are not systemic, right, they are seeing that person, the client's life through like a very small like window. And so that pathologizing may come into play, or like it's more about like, let's give you some coping skills, let me give you an assessment, let me kind of put the responsibility of your symptoms on you and how you see the experience versus like the reality of the context. And that's not a very good feeling to have.
Yeah.
Right? If somebody comes to me and they're like, well, maybe if you just thought differently, right, things would change.
Yeah.
Even though I'm still like experiencing like the systemic oppression or the microaggressions at work.
Yeah.
Right? If I keep having a therapist who's like, well, maybe they didn't mean it that way.
Yeah.
Or like, how can you think about this interaction in a different way? It's not going to change my interaction.
Yeah.
If I think about it differently.
Yeah.
And so it really does place the blame on the individual.
That's
And
that's
I don't
fair.
think people like that.
Yeah,
It doesn't feel good, right?
Yeah.
It brings about helplessness,
Yeah.
especially when you feel like, well, this keeps happening over and over again, then maybe the issue is me. Like, I may be the common denominator.
Yeah.
And people start to internalize their symptoms.
Yeah.
And they don't seek help altogether.
That's true. I feel like a lot of people get deflated after like having an experience like that in therapy, where they might get that approach or that kind of a thing.
Yeah.
And I was actually talking with a coworker of mine the other day. She read some kind of a research out there where people who have gone through the cognitive behavioral therapy, which is like a standard for the psychological lens, have found it to be more harmful than good, because kind of like what you were saying earlier, it's like, here's someone telling you, just change the way you think and you will feel better, or some version of that. Or obviously, like, not all therapists with a psychological lens are that way, but some that leaves a bad taste in some people's mouths. For some people it works, and for those people great, but for the people it doesn't, it can really do more harm than good.
I had a client that she did an intake session with me, and the reason she came to therapy was her partner was grieving the loss of his father, and he was kind of isolating in the room, wasn't interacting with his children anymore, and so she came to therapy because she wanted to figure out how she could stop feeling resentful, and how she could have better coping skills for herself to be able to communicate with her partner better. I was like, how much of a responsibility do you have in how your husband shows up to this marriage?
Yeah.
And she's like, oh, yeah. Right? And it's that thinking of I'm placing the entire blame on myself when this is a relational issue. Right? It's nearly impossible to understand a relational issue from an individual lens. And so when she came to me with, I need to be better on how I deal with my frustration over my husband kind of checking out of the marriage, I really thought, I was like, I'm very grateful that I'm a systemic therapist. Because, somebody could easily be like, all right, let's give you some coping skills, right? Let's kind of, continue focusing on you and your response, which is a natural response to not seeing your husband for 2 weeks and him not caring about what you've been doing, and not asking about how was your trip, right? And I can't get a word out of you and interact with you, anybody would be frustrated. But her response was, why am I frustrated? Not why isn't my husband showing up for me? Right? And so as a systemic therapist, we look at patterns of behavior. We don't try to solve problems. We try to understand patterns.
And that's huge.
And so it's not about what is wrong with you. It's about what can we shift to give you a different experience. Because her husband has the right to grieve their loss of their parent. She has the right to feel frustrated because she feels alone in the marriage. It doesn't mean one person is wrong versus the other. There's nothing to fix or solve. It's more about how do we adjust. And I was like, wow, and of course she came from a very individualized culture. And so that I think had a lot to do with how she was socialized.
And that is a really powerful shift. We try to find cycles of behaviors, patterns, and patterns you can shift. You just need to make 1 or 2 changes, and it really does impact the entire system. And that, to me, it sounds like it produces longer lasting change and bigger ripple effect of change.
Because I can give her all the coping skills she needs. But if her husband is still showing up the same way, the pattern is going to continue, and nothing is going to change.
So one of my favorite things about you, Zam, is how open you are about how much more of a benefit the systemic lens is to our clients compared to the psychological ones. And I love that about you. No shade to psychologists.
There's a lot of systemic psychologists out there.
And there's a lot of systemic psychologists. So that's, and I guess that's what I wanted to speak to.
They're the outlier, right?
But they are the outlier.
Systemic psychologists.
That's true. They're really going against the tide of the school of thought of psychology, the traditional school of thought of psychology.
Absolutely.
So then I guess my question for you is, if, to anyone who's listening to this or watching this and thinking, this is a cult, or this is just people bashing on the therapists of the world. How, what might you say to someone like that?
I was a psychology major myself. I took 4 years of psychology, right? Like, I was going to become a licensed psychologist. I thought that was the only way.
Sure.
Right? Like, because of just like how old the institution is of psychology.
Yeah.
People, it really feels like this is the only way that we can do therapy.
Right.
And MFT is very new, right?
It is.
It's like a couple of decades old, and psychology has been around for centuries.
Yeah.
And so it really does align better with the lived human experience.
Right.
We get away from the medical model, which is great for physicians, right? They need symptoms so that they can look at what's going on and give you a treatment.
Right.
But we can't use like physical symptoms and understand them the same way as we look at relationships,
right?
And because humans are so complex, right? Like, and so we need that complexity, and the psychology really does oversimplify a lot of the symptoms that people have.
100%. I remember when I did my graduate program, my marriage and family therapy program had, like, next door, there were other therapists who were being trained in the psychological ones, and they had us cross paths once. And I remember the person that was paired with me, who was, trained in counseling psych, she was so adamant about figuring out the diagnosis. Like, she was so adamant about getting it right. And I remember in that moment thinking, like, what if it's not about getting it right? What if it's just about, empowering the client to, in whatever language that works for them, to find healing and change from that experience?
Think marriage and family therapy has a lot more theories. They have a lot more. They kind of put a lot of thought into why, right? The how. And so we are training various different theories where people can, like you saw me kind of take two together, and you can kind of adjust. Because we need to be able to articulate why are we asking certain questions, how do we know something is not healthy or not, right? And if we're only focusing on like CBT and like you're thinking wrong, like we're losing the human part of this experience. Like when I'm thinking about things from a theoretical perspective, I'm grounded in research. I'm grounded in a shared understanding that has been proven to work. And I can adjust it according to the culture that I'm working with. And so I know why I'm asking certain questions. I can explain to clients why, and I am able to check myself. When I'm asking more questions that are individual. It really changes the conversation, right?
It does.
Focuses on what are you doing wrong versus what's happening around you. And falling back on systems, I can ensure that I am not harming my clients in any way. I'm not like a blank slate. I'm not like this super neutral person. I have biases. I have lived experiences.
I love that.
And if I am aware of those things, I can also be intentional about the work that I do.
100%. There's so much danger, I think, to any human who shows up and says, I am neutral, or I am not racist, or I am like a blank slate. None of us are.
Then you're not human.
Then you're not human. Then you're not human. So then to wrap up, I guess there might be therapists who are tuning into the conversation who are already doing a lot of great work in the community and probably come from, many different walks of life. To a therapist who is listening to this and might be like, this is their first time hearing about this, or maybe like this opens a different perspective for them, what might be your advice to, like, the average therapist?
I think it goes back to what I said earlier about MFT has a lot of theoretical understanding that is grounded in systems thinking. And so exposing yourself to more marriage and family therapy theories, and just really like learning about how we understand how people operate, how these systems are connected, what to look for, right? Like how to ask relational questions. Right? You can do relational work, with one person, like we talked about before, right? And so I think it's not about like getting new training, right? It's more about like how do I kind of expand my understanding of what health is, what is like human behavior, and how can I incorporate systemic thinking into the work that I'm already doing.
Gotcha. So you're inviting them to kind of expand what they know or what they were taught.
Contextualize.
And to someone who's listening who might be more of like a average human who is listening to this, and maybe they are thinking about therapy, or they have had previous therapy experience that was not so helpful, what might your advice be to them?
I would say, right, like it's going to take some time and a couple of tries before you find a good fit.
Okay.
And so just normalizing that it's okay
Sure.
if you don't jive with this person.
Yeah.
And just try again. Try to find somebody that you feel like you'd be more comfortable with, whether
Sure.
that's lived experience, whether that's like age, right? Like whatever it is that allows you to kind of be in this space in a way that's like safe.
Yeah.
And that helps you open up.
Yeah.
Try to find that safety first.
Makes sense.
And I think marriage and family therapists are
There's your plug.
are trained in a way that is unique. Right? Not better.
Yeah.
Unique.
Yeah.
And you're able to kind of have somebody that understands and operates in a way that's different from other providers of care.
Makes
and
sense.
I think that is one way to help not recreate the dynamics that maybe you experience in other spaces.
That makes sense. So you're saying, like, maybe pursue a marriage and family therapist, but
Maybe.
but maybe what's most important is to find that someone who you feel comfortable with, who you feel like is curious and kind of is willing to want to understand the whole human version of you, the context that you're in.
Yeah.
And to really like lean into that feeling that that's something they should be able to look
think
for.
about like the types of questions they're asking you. Do you feel like it's aligned with your lived experience?
Yeah.
Right? Are they asking you things that you don't have to bring up yourself?
Yeah.
Right? Are they considering different types of experiences that you have?
Yeah.
Are they communicating from a both and perspective versus black and white?
Yeah.
Right? Are they kind of okay with asking you about like ambiguity and kind of multiple lived experiences happening, like coexisting at the same time, right? Those are systemic languages to look for. If somebody's only focusing on like what you're doing wrong, or they want to like prescribe you things to do, that only is focused on your behavior,
or is giving you advice,
or giving you advice, run. But that tells you this person is not systemic.
Yeah.
And so they're only going to be able to help you with one slice of the pie.
Yeah, that's fair.
You want as many slices as possible. You may not get all of the pie.
Yeah.
That's okay. Because, therapy may not be your end-all, be-all for all of your problems to be solved.
Yep.
But it's more likely that you will be able to get the support that you need from a systemic perspective.
And that might be finding a therapist who is that way might be hard, but possible
If you don't know what you look for,
if you don't know what you're looking for. Yeah. All right. Well, I guess with that, any final thoughts?
Oh, that's any psychologist that you're listening
There goes our former apology.
I wanted to be a psychologist for a long time. No, I would just say, I really love the fact that a lot of people are looking towards therapy nowadays, right? It's becoming more socially acceptable. And, right, it's like the assumption that the first person that you find is going to help you solve all your problems is really difficult, right?
Yeah.
Sometimes people need to see more than one doctor to be able to figure out what's wrong.
Right.
And so it doesn't mean that therapy is not helpful.
Yeah.
It just means this was not a good fit.
Yeah.
So just keep trying.
Yep.
And you have autonomy and control over the amount of information that you share.
Yeah.
What you want to work on, and if you don't feel like you're being heard, or if this person isn't very collaborative, that may be an indication that maybe you can try somebody else. Like you don't have to be stuck with this person that you've chosen.
Fair.
Because this is your life, your experience, and that you have control over it.
Yeah. Well, thank you, Zam. I really appreciate this.
Thank you for this conversation.
All right. Well, that's a wrap. Thank you, Zam.